Hello, my name's Paul and I'm a patient at the Christie Hospital endocrine team. I've previously made a video clip about the taking of medication following pituitary surgery. But it occurs to me that you may be a completely new patient and you've just been diagnosed, and your biggest worry is actually having surgery to remove a pituitary tumour. So I thought it may help if I just tell you a little bit about my experiences having surgery. It can be not just daunting, it can be frightening, it can be terrifying when you first hear the words tumour and surgery and brain surgery. I can understand why anybody would be concerned and upset. However, the experience and the reality is nowhere near as frightening as thinking about it beforehand. So I'd like to just describe a few things that happened to me. I was diagnosed with having a pituitary tumour, and I was diagnosed rather late. So much so that when they discovered on an MRI scan the size of the pituitary tumour, which they described as being the size of a golf ball, they decided that they needed to operate immediately because it was pressing on my optic nerve and I was already starting to lose the sight in my left eye. So having gone into hospital thinking I was just going in for some tests, I was told that I was now going to be operated on the following day. So the first thing I had to do was to phone my wife and tell her the news and tell her that she better, if she wants to see me, she better come in and see me, because I wasn't coming home that night like she was expecting me to, and ask her to bring all the necessary things. I then had a visit from the surgeon who was going to conduct the operation, and he told me what it entailed, went through and answered any questions I'd got, and I felt very comfortable that he was a very competent and experienced neurosurgeon. I then had a visit from an anaesthetist who obviously wanted to check that I was okay for having a general anaesthetic, and he again asked me lots of questions and put my mind at rest. I didn't actually go into the operating theatre until 8 o'clock in the evening. It was because they'd had a very full and busy day, as operating theatres often do. So it was 8 o'clock at night when I went into the surgery, and the procedure took about 2.5 hours. Now, some of you, when you first hear about brain surgery, you imagine they're going to cut a big hole in the side of your head and drill through, and it's all very frightening. But for pituitary surgery, they don't do that. It's in a very inaccessible place. The pituitary is situated right in the middle, underneath the middle of your brain. And the only really satisfactory way to get to it is through the sphenoid, the sinus cavities behind here. Now, in my case, the route into to the surgical site was up through the top of up above my mouth through there. But most operations these days are now done through the keyhole surgery through one or both of your nostrils. So there was me. It doesn't really matter which of those two. They both end up in the same site, and it's still keyhole surgery. So I knew what was going to happen, and obviously I didn't know anything that was taking place during the procedure. As soon as they'd finished the operation, I was immediately transferred to the intensive care unit, where I stayed all night. And when I came round, first of all, I was conscious that I was there. I was conscious that my wife was beside me, and I was conscious that there was another person there who was actually the nurse who had been assigned to monitor me for the next few hours. I was also conscious that I had a little bit of discomfort around my nose, and I knew that I'd got various tubes up and down in my arms and catheter and things like that. The role of the nurse who was there was, and I got the impression that it was almost like one-to-one care. His job was to monitor me under neurological observations. And it seemed to me that he was going to do this about every 15 minutes. There's no chance of me nodding off to sleep for very long, because he'd be tapping me on the shoulder and he'd be saying, "Hi, Paul, how are you doing?" And I say he, because he was a male nurse at the time. And I felt very comfortable. I felt very, very safe. I felt that here was somebody whose sole role that night was to look after me and make sure I was okay. He would ask me questions to provoke my thought. He would ask me to wiggle my toes. He would ask me to move my hands. He constantly was up looking in my eyes and looking for signs and monitoring, obviously, my pulse, my breathing. And as I said, I felt very, very safe. The next morning, I was moved back to the general ward, and when my family came to see me, some of them were a little bit upset because the first thing they saw was me with tubes all over the place and great big dressings around my face, and it looked much worse than the reality. And the dressings consisted of two great big wads right up inside my nose, which made my nose swell out and made my face look puffy, and yes, my face was swollen. The other thing is that I had a catheter in amongst all the other tubes, and one of the concerns right immediately was that I seemed to be passing an awful lot of water. I seemed to be getting through about 1 litre every hour into this catheter, obviously being replaced through other tubes and drips, and also asking me to drink. And it turns out this is quite normal, because I don't understand the exact clinical technicalities of it, but when the hypothalamus is stretched, it makes you want to go to the loo, go for a wee much more. So that was happening, and they told me about it, and they said, don't worry, that will calm down, and they had to monitor that as we went. I then also started trying to feel my legs, because I'd been told in advance of the operation that it may be that they might have to take a small incision and take a small piece of tissue from my thigh to act as a patch over in the back of the operating site. The reason for this is that one of the high-risk areas is that they must not let any cerebrospinal fluid leak out during the operation or afterwards. And if they think there's any risk of that because of the work around the operating site, they put a little patch of your own tissue in there to seal it up. But in my case, they said that wasn't necessary. So I discovered that for myself by feeling my legs and realising they hadn't taken, there wasn't any little operating site down there. So there I was, recovering. I think I was up on my feet within the end of that first day, capable to walk to the bathroom and back. And then, of course, it was a great pleasure when they took the catheter out. And each day that went past, I was getting better and better, and I was feeling okay. Obviously, I had regular visits, not only from the surgeon, but I then started having regular visits from the endocrine team, because these people work together as one. The surgeons do the initial work, the cutting out bit, but it's the endocrine team who then need to monitor how you're doing. What's happened since they took your pituitary away? And what are you making of your own volition, and what do you need to be replaced? So they were constantly monitoring my bloods several times each day in the first few days. I stayed in hospital for a further, I think it was 9 days. Yes, I had my operation on the 9th of December, and I went home on the 22nd, no, 11th of December, and I went home on the 22nd. So I think I was in all there about 10 or 11 days. And for most of that time, I felt pretty good. In fact, for the last half of that, I had my mobile phone with me and my laptop, and I was able to do a certain amount of work. And thereafter, life has been just very quickly got back to normal. I was very pleased to go home. I was very pleased that it had been dealt with. And the amazing thing, the sight problem in my left eye returned within 3 weeks to normal. So good, successful outcome. And there is certainly nothing that you need be afraid of or worried about.